is Kayla Masters, and this is my final presentation for capstone. And my presentation is about nurse burnout, and the title of it is called "When Will Nurse Burnout Ever End?" Nurse burnout has been a prevalent issue for many years now. The problem seems to appear in almost every healthcare facility. As a nurse starting out on a med-surg floor, the issue was very apparent to me. There are various noticeable repercussions and consequences of nurse burnout as well. As a new nurse myself, I was always told to begin my career as a medical surgical nurse. The reasoning for this is because as a med-surg nurse, they experience very stressful situations, and the nurse must critically think through a situation, ultimately resulting in a better nurse. The 1 year I worked as a medical surgical nurse, I experienced extremely strenuous medication passes, a super high patient to nurse ratio. And when I say high, I mean 1 nurse to 7 or 8 patients, and emotionally and physically abusive patients. There was more than just one reason as to why I decided to transfer my nursing career to the neonatal intensive care unit, but the factor that determined my transfer was how unsafe the medical surgical area can be as a new nurse. To further elaborate on this, nurses are also human. One of my favorite books from nursing school mentions this, and it was called "To Err is Human." One small mistake could result in a medication error, or a wrong patient could receive a wrong medication. The list goes on and on. When I realized how unsafe the medical surgical profession actually was, I was scared that I was going to lose my license. As a new nurse, you still have so much to learn, and you're learning every single day. On a med-surg floor, there's almost not enough time in the world to fully learn how to complete nursing tasks safely. The objective is to get all of the patients, all of their medications done on time, get all treatments completed, make sure everyone is comfortable, and sometimes you just have to figure out how to do it as quickly as you can. This can result in error. Medication passes end up becoming more fast-paced, which can result in a nurse missing any type of error. Treatments can be completed on wrong patients. There are multiple ways on how a nurse can complete an error. I chose nurse burnout as my capstone topic because this is how I felt after only 1 year of working as a registered nurse. If I only worked as a med-surg nurse for 1 year and I was so miserable, how do all these other nurses in this profession feel after 5, even 10 years of staying in this profession? This project subject was chosen to hopefully bring awareness to others about the current safety and stress issues a nurse must endure. This will highlight the critical aspects of nurse burnout and possibly find a viable solution. The goal of this project is to explore the nursing experience for 8 nurses. These are all random choices. The researcher will have 4 medical surgical nurses and 4 neonatal intensive care unit nurses fill out a questionnaire to determine whether nurse burnout is present. This questionnaire will answer if a certain specialty experiences burnout more, if burnout is related to a shift a person works, or if nurse burnout is directly related to how long the nurse has been a nurse. Nurses are aware of the strenuous, high-stake environment from day one, but not many truly understand the burden or the pressure until they step on the hospital floor for the first time to work. There are many different factors and circumstances related to the intense pressure nurses experience. To name a few, nurses must carry out heavy medication passes, emotional strain, physical and mental exhaustion, and even patient-to-nurse abuse. Nurses continue to complain about constant exhaustion and never feeling refreshed. However, very little has been completed or even trialed to fix this complaint. The reasoning for exhaustion all ties into one major issue, and that issue is the lack of nurse staffing. A few other factors that can include in nurse burnout include inadequate staffing, an environment of constant change, and the nurse must always be willing to learn. Many human resources employees have career fairs, reach out to nurses, and even advertise current job openings to other nurses. But what is being done to have current employees feel wanted in the workplace? The current nursing staff should be targeted when it comes to attempting to please the staff. These members already know how to complete nursing tasks on the floor in a timely manner, so why not try to make the current staff happy while working? Why not go above and beyond for the nurses who do a great job taking care of the patients? It has become obvious to most hospitals that staff are underappreciated, and the managers become dumbfounded when nurses request to transfer elsewhere or even quit altogether. A solution to try and conquer nurse burnout would be to show the current staff how appreciated the nurses truly are. And once these nurses feel important and they enjoy the work environment instead of just tolerate it, it's less likely that these positions will need filled because the nurses will stay and work for them. Nurse burnout is present in almost every single hospital worldwide. There are many factors of this issue. A few to name include long and tiring shifts, constantly feeling overwhelmed, inadequate staffing, busy high-stress environments, and constantly trying to cope with others' illnesses and deaths. This problem begins by affecting the nurse experiencing burnout, but then it gradually begins affecting coworkers and then the patients the nurse takes care of. This study is important and will help nurses further prevent nurse burnout and eventually enjoy the career path that they started out as loving. The statement of purpose for this final project is expected to create better outcomes for nurses experiencing burnout and even hopefully to prevent nurse burnout altogether. The ideal way to accomplish this would be by creating tips and strategies for nurses to follow, as well as informing managers and others involved to show the nursing staff how appreciated these members really are. A few examples would be by ensuring nurses to create individual time to relieve stress and relax, ensure nurses have teammates to debrief with, and to know the signs and symptoms of exhaustion and knowing how to prevent further stress. A few ways to show staff appreciation would be by small notes of gratitude, one-on-one conversations, and even small lunch gatherings to show thanks. There are many easy ways for a nurse to feel appreciated. A few of the terms used in this final presentation include nurse burnout, exhaustion, fatigue, debriefing, and depersonalization. Nurse burnout is a term in which is described as a physical, mental, and emotional state caused by chronic overwork and a sustained lack of job fulfillment and support. This term will be the main concept of my final project. This term will be used to describe fatigue and depression of nurses present in healthcare settings. The next word that I will be describing is fatigue, and this word just means extreme tiredness resulting from mental or physical exertion or illness. This word is used as another synonym for burnout or exhaustion. Exhaustion is defined as a state of extreme physical or mental fatigue. Debriefing is known for providing emotional and psychological support immediately following a traumatic event. This word will be used to describe an intervention or help a nurse prevent their burnout. Lastly, depersonalization is a word that describes a feeling anyone may experience, and it may feel like the individual has lost touch of reality, almost as if the individual is viewing life from another person's perspective. Depersonalization usually results from stress, leaving the individual feeling depressed and out of touch with reality. Nursing then versus nursing now can be looked at as completely different. Nursing then only had paper charting. Math calculations were all done by hand to determine safe dosing and proper IV drip rates, and all orders from a physician were verbalized face-to-face. Nursing now includes only electronic charting and electronic medication administration records. IV pumps automatically calculate all math for IV meds, and orders can be completed by texting and calling the physicians and asking for them. One thing that never changes between nursing then and nursing now is that learning never stops, and you're constantly improving practice to ensure that evidence-based practice is always being used correctly. I placed the nursing then versus nursing now slide in because I believe that nursing then may be the reason why the more seasoned or experienced nurses are leaving the profession before their retirement age. I believe that the changes in nursing can be very sudden and very dramatic, and someone who has worked and done the same way for years upon years, this may be very overwhelming, and a lot of people end up not liking change. They just want to go get their job done. They want to do it the same way that they have done it for years, and this can be seen as a threat and something that the other nurses may not like. Within my study, I found a journal article that had a lot of great points that were brought up in their journal. So the first one that I wanted to quote was, "Nurses nationwide consistently report that hospital nurse staffing levels are inadequate to provide safe and effective care. These physicians agree, citing inadequate nurse staffing as a major impediment to the provision of high-quality hospital care." This study was conducted and the results came out back with no surprise whatsoever. The study was to determine what type of nurses, and the nurses included high patient-to-nurse ratio versus low patient-to-nurse ratio, and to see who were more likely to leave their nursing position first. The study resulted that the nurses with a high patient-to-nurse ratio were 2 times more likely to leave the position first. The end result concluded that the high patient-to-nurse ratio nurse leaving the hospital within 1 year of work, which is what happened with most of the nurses that they trialed. So for this slide, I wanted to go a little bit more in depth with depersonalization, and depersonalization is a downfall from nurse burnout, but this can be potentially fatal. Depersonalization occurs after the stress level is past the breaking point for an individual, causing the nurse to become passionless and completely emotionless. The nurse who experiences depersonalization lacks energy, constant negativity, loss in satisfaction at work, dehumanization, negativity, and even self-isolating behaviors. It is apparent that it is very dangerous, not only for nurses, but patients as well. The nurse will feel less obligated to practice safe nursing on these patients, which would most likely result in this patient harm. My thought process for this project was to ensure that I kind of came in and created interventions for nurse burnout before it got too detrimental and even leaded to depersonalization. The way I plan to intervene is to create my survey, just enough for 8 nurses. 4 will be left for my colleagues that I used to work with on 6 Yellow, which was an ICU step-down unit and med-surg unit, and the other 4 will be left for nurses in the neonatal intensive care unit, which is where I currently work in. The research used in this research proposal will utilize research questions such as a survey. This survey will consist of questions that will be used to determine whether nurse burnout is present within the current workplace. By determining if nurse burnout is present, then interventions will be discussed and placed to prevent further nurse stress and possibly preventing nurses from resigning their positions. The research will be qualitative. Qualitative research is aimed at gaining a deep understanding of a specific organization or event rather than a surface description of a large sample of a population. It aims to provide an explicit rendering of the structure, order, and a broad pattern found among a group of participants. The research is based on how the nurses perceive work and how to make the job better. The reason that I chose a qualitative research is because nurse burnout can be subjective. So to better find out, it's not to see how many nurses, as per se, how in depth they're feeling nurse burnout for me. My questionnaire consists of 7 questions. 4 I have used on a previous survey, but I decided that it needed to be more in depth, especially since I added the NICU nurses into my study. The questions that I have include: have you ever personally experienced nurse burnout? Do you feel as a nurse you are constantly exhausted after work? Do you feel as a nurse you are overworked and underappreciated? Do you feel as a nurse you are not satisfied with the specialty you have chosen? What about the nursing profession as a whole? Do you feel as a nurse that the nurse-to-patient ratio is unsafe? The other questions that I added in included: are you a new nurse, such as like in between anywhere from a new graduate to 2 years of nursing experience? Or are you considered an experienced nurse? Do you work day or night shift? And lastly, do you work as a med-surg nurse or do you work as a neonatal intensive care unit nurse? The last question is so that way I can determine if the person, since everyone is going to be anonymous, this way I can still determine whether or not it was based on the profession that the nurse was in or if it was just nursing as a whole. As I had mentioned previously, the population of samples includes my former coworkers present on 6 Yellow and my new coworkers on 4 Yellow, which is the NICU. The intent of my project is to ensure that there are enough nurses who are eager and willing to participate in my survey. The results will be brought to the nurse manager without any names on the surveys, keeping them completely anonymous, and then reviewing the results. The participants will need to fill out a conflict of interest agreement form prior to participating in this survey. The survey will be administered by the researcher. The questionnaire will not be handed out though. A group of nurses on day shift for 6 Yellow and 4 Yellow will be gathered to explain the survey and its purpose. This step will then be repeated again for night shift. The next step will be to inform the possible participants that the survey will be random, so it will be left out on the nurses station for willing participants to fill out. Although the survey is self-selected for which units will be participating, the survey will be randomized after the self-selecting is completed. The questions will be on paper, but there will be also enough space, so if the nurse would further like to elaborate, they are able to go more in depth on the survey questions. As predicted, the survey results concluded the medical surgical nurses all resulted in nurse burnout. while the NICU nurses claimed to love the nursing position and had no complaints whatsoever. The nurses who circled day shift versus night shift had no difference within the result. The only difference was the type of nursing profession. These results were promptly sent to each of the floor's nurse managers, and due to COVID-19, the nurse managers wanted a contactless meeting instead of a meeting face-to-face with me. Each nurse manager reached back out to the researcher and thanked the researcher for determining how their employees felt. One of the medical surgical charge nurses reached out to me after discussing the research results with the nurse manager and asked for suggestions on how to make the work environment more enjoyable and less stressful. As listed previously in my presentation, I gave out to the charge nurse the interventions for nurse burnout, and the charge nurse volunteered to reach out again in 1 month to explain after the new interventions were in place, as well as the results of the nurse burnout after, to see if they had gotten any better.
Thank you very much for listening to my presentation. It was actually kind of hard to create just because I feel like nursing burnout is a very broad, just an overall category. So to just kind of make sure I had every type of information that I wanted in there, and then the survey questions were very broad, but I feel like they still got the point along to all of my samples. So I hope that you enjoyed my presentation as well, and thank you again for listening.